Okay, Candace, we're ready.
Okay. Can you tell us about the recent survey that took place?
Yes, Walgreens just conducted a survey of consumer perceptions about vaccinations, and it was quite interesting. People are highly aware of the need to be vaccinated against certain contagious diseases, but they actually don't know what they themselves need. That's what we found.
And were there any results that surprised you?
Well, beyond that, 90% knew that vaccines are available. Only 40% knew what they needed. Shingles, another area of a lot of attention recently. That's an outbreak of the chickenpox virus that all of us had as children, and now has a chance of infecting 1 out of 3 adults in older years. There are a lot of misconceptions about that. Most of the surveyed folks thought 1 in 8 people had a chance of getting it, as I said, 1 in 3. And the other misconception, they thought that washing hands and getting extra sleep during the winter would prevent shingles, and that has nothing to do with preventing it. Only one chance you have of preventing it, and that's getting the Zostavax vaccine.
And how have the latest immunization trends impacted herd immunity, and why is it important?
Well, herd immunity is a very interesting concept. It's a scientific concept that says once 85 to 95% of people in a community are immunized or immune to a disease, it's very hard for that virus or bacteria to cause an epidemic or an outbreak in that community. So we really need all of the folks in a community to be immunized, not just for yourself and your immediate family, but for everyone there. And the best example of where this has become apparent is whooping cough. Whooping cough we haven't seen for decades in this country. We're all immunized as young children, and now we're seeing the worst outbreak in 50 years across the U.S. And so we need to pay a lot of attention to whooping cough.
And what shots should travelers be considering for the holidays, and when?
Yes. So holiday time, Thanksgiving, Christmas, New Year's, we're all crowded into houses at parties. The weather is colder, viruses flourish in colder weather, and we're on planes, trains, and buses and things like that. So all of the contagious diseases really spread. Everyone has to get a flu shot. It's very important. The flu changes every year, and so if you had one last year, that's great. That doesn't give you immunity for the new viruses this year. It's simple. It's covered by most insurance plans. There's either zero or no or small copay, and we offer that at all the Walgreens stores. This year we decided to also offer an immunization assessment. So you come in and get your flu shot and then sit down with a pharmacist or one of our nurse practitioners, and by age and past history go through what else it is that you might need. And just one last thing for travelers, that whooping cough, adults need to be getting a booster shot right now before the holiday travel season, because it looks like those of us that thought we'd have lifetime immunity don't, and if you're an adult, you need a booster shot of the vaccine to prevent whooping cough.
And do you have any additional information you'd like to share with us?
I do. Walgreens.com/flu. That's walgreens.com/FLU. We created all sorts of information, and I just want to reiterate, we opened up access for patients and consumers all over the country to get information and the actual vaccines at any Walgreens store all of the hours that we're open 7 days a week. So I'd encourage people to find out what they need, protect themselves and their communities.
Well, thank you so much, Dr. London. We truly appreciate it.
Thank you, and you have a great day.
You too. Thank you. Bye-bye.
Bye-bye.